Hi, I'm Amber Beauty RN, and I am here today with Marco, and he is a handsome guy that has some scarring, and I wanted to feature some carboxy therapy because, again, it's a really natural type of treatment. It's carbon dioxide gas. It does lots of different things for our bodies and our face, our tissues, we'll just call it, in that it can stimulate collagen, it can break open fat cells and dissolve fat, and it can also work on scarring. So whether it's a post-surgical scar, whether it's an acne scar, or something that's a little bit more raised, like a keloid scar. So Marco has had some type of trauma or injury at some point in time, and possibly even surgery, because a lot of people who can develop keloid scars. I generally see it more in people who are any skin color darker than me, but there's an excess of keratin in the skin too, and so our body's healing response just kind of multiplies, and so it leads to the end result, which is a raised scar. So Carboxy will help that scar in that it's the raised area. It's going to break up and dissect that fibrin mesh and help to bring it back down. Some of the results are almost instantly. Sometimes it takes a few treatments to really start to see results. Because it's not a surgery, it's something more mild, you do have to do it repeatedly. And you have said before that you had some Keloid treatments, some steroid treatments directly injected. That's also a nice adjunct therapy to it. I have seen great results with just carboxy therapy in itself. So carbon dioxide is going to be delivered to your skin via this little tiny needle. It's a 30 gauge, which is basically the size of a Botox needle, and it's going to go in. You may not even feel anything, Marco, because a lot of times when you have a scar, it doesn't necessarily have all the same nerve endings that you do in, untraumatized tissue. So I'm going to go ahead and get started here, okay? Right. Okay, here we go. 1, 2, 3. You feel anything?
I do.
Pressure?
Just
little
a little
stinging,
poke.
maybe?
Mm-hmm. A little
Yeah,
stinging.
that's just probably the needle there. You can see it's actually becoming a little more raised. Good response, because sometimes it's difficult to even get the needle underneath because that scar tissue is so fibrotic, but yours is not. It's nice and soft. So we just kind of give it a little bit of a massage. There's one area right there that feels a little more fibrotic. Okay. So we'll see, if it even stimulates some hair growth. It's probably not, because I see some hair follicles that are not active anymore, but I do see a couple in there. So if you're desiring to have some hair growth in there, it might help with that as well. Okay.
Great. Yeah.
So here's a little bit more of a fibrotic area right here. So we injected that a couple times. It's a little pink because of the oxygen going into the tissues there and actually hydrating the tissues, and I've caused a trauma as well. So does trauma beget trauma? It's not going to end result in a further keloid. It's actually treating it because it's a different type of trauma. So it's a little raised, but within the next few minutes it will be metabolized in the body as we're exhaling, because that's what we exhale, is carbon dioxide gas. And you'll be able to probably feel a difference, Marco, within minutes of having this treatment done.
Great.
Okay, so I'll probably see you back in a week or so, and we'll do another one, okay? So we just finished a carboxy treatment here for Marco. We're just gonna separate those skin layers to treat that scar. It's just one of the many different treatments that carboxy can do for you. Very naturally, no downtime, very minimal bruising. If you have any questions, please contact me and we can go over an assessment with you and address your needs and talk about a treatment plan.